Hello, Mr. Hopkins. How are you?
Fine.
That's good. My name is Miss Jantel, and I'm the student pharmacist here today from Chicago State University. And basically, the purpose of my visit with you today is because doctor prescribed you new medicine, which is actually insulin to lower your blood sugar. So it's going to take less than 5 minutes. Is that okay?
Sure.
So I just want to briefly go over with you, Mr. Hopkins, on how to use the device. So what I would want you to do is gather your supplies, which you would need your insulin pen, and it looks like this. You would need alcohol swab. You would also need the pen needle to inject yourself with. So what I would want you to always do is open up the pen and do what is called a blind air shot, which is basically you're just going to turn the dial to 2. You see that? And take the alcohol swab. I would want you to just wipe one time facing you, the tip of this, for sterile reasons. And then you can use the other side of the pad to swab yourself wherever you're going to inject. So if you were going to inject in your thigh, you would just swab yourself right there. So you open up the pen needle. And as you can see, the needle in there, you're going to attach it and just screw it clockwise. Pull, and you'll see that this pink tip is covering the actual needle, okay?
Okay.
So now we've already dialed it up to 2. And so we're going to do our blind air shot away from yourself. It's going to squirt. So that indicates to us that the insulin pen is working, okay? So on these instructions, doctor has prescribed you to take 30 units. So you would just dial it to 30. And what you would do, that area that you prepared for injection, you're just going to squeeze it like so, as I'm doing on my skin right now. And then you'll just, very good, and then you would just inject it on a 90-degree angle. And then you would just push all the way in to depress the full dose of the medication, okay? Once you've done that, what I would like for you to do, Mr. Hopkins, is to keep the needle in place for a minimum of 10 seconds. This is to ensure that the full dose is injected into the body, okay?
Okay.
Once you've done so, you can remove it from the body. And now you would never recap with this pink one because you can risk injuring yourself by sticking yourself with the needle. You would recap with this larger one. So you just place this back on and screw it counterclockwise. You've removed it. You're going to put this in an appropriate sharps container, which we have right off to the side. Place your pen back. And this can be stored outside of the refrigerator for a maximum of 30 days.
Okay.
If once it's used. If it's not being used, we recommend that you store the insulin pens in the refrigerator. So now, Mr. Hopkins, just so I can verify and make sure the doctor understands that I did cover everything with you, could you basically just like teach back to me everything that we've discussed?
Sure.
Okay.
So this is the insulin pen. So remove this.
Mm-hmm.
Yeah.
You want the alcohol?
Yeah. So first I would swab myself,
Mm-hmm.
or I would inject myself,
Okay. Right.
and then take the other side,
Mm-hmm.
swab this, and this clockwise.
Mm-hmm.
Now the needle's on there.
Mm-hmm.
So here's shot.
Move your pink tip to expose the needle.
Away from myself.
Very good. We see your medication.
Okay, so then, here it is. And if I'm gonna do 30, so I would turn this
Okay.
30,
Okay. And you,
inject myself.
okay, good luck. Okay.
Then I wouldn't use this because I don't want to risk injury. I would use this
Mm-hmm.
and counterclockwise to unscrew it off.
Okay. Very good, Mr. Hopkins. And some other key things that I didn't point out I would like to mention. As far as injection sites, you can inject in the abdomen, not inside the belly button, but in around the perimeter of that, the pads of your thighs, and then this part of your arms. And you
Okay.
would want to be rotating those sites.
Okay.
But otherwise, everything was perfect. And if you have any questions, Mr. Hopkins, my information for contact is on this box.
Okay.
And since you are on a blood sugar reducing medication, I definitely would want you checking your sugars regularly. Okay.
Okay.
Making sure you are within those goals that you and doctor talked about. Okay.
So what are some of the downsides?
Well,
Or
some
like
of the side effects with this medication would definitely be low blood sugar, because this is what it's for. So this is why it's important for you to monitor your blood sugar, so you don't want to go too low. Okay. So thank you very much, Mr. Hopkins, and have a great day.
You too.
Bye bye. Get that rid of that.